Hi, my name is Lee Hopkins, and I'm a patient of Dr. Mork. And to explain my situation, I have back problems, and I've had them since I was really young, but mostly my problem, everyone is different, and my problem is basically arthritis, I think. Well, when my friends ask me, what kind of a problem do you have? I usually begin by explaining that, well, everyone is different. They have a back problem that's different, but as you may know, your spine is like a column, and as you grow older, then your spine actually normally goes downward, which on each vertebrae you have two holes, which your nerves come out. And I try to explain that as you grow older, your spine goes down and the holes become squeezed, and therefore you have what is called stenosis. And that's using a medical term. And stenosis is pinching of the nerve. And in my cases, it unfortunately is in different levels. And so then you have to address each problem specifically. And most of the problems that I had was that I was going from doctor to doctor, and each would say, well, your problem is L3 and your problem is L5, and everyone was different. This little bone over here, that's where your pain is. And so I was basically just going between many doctors, and the last one said, well, look, you have bone upon bone at the L5, and that's definitely where your pain comes from. Well, with Dr. Mork, very specifically can locate through pain mapping, which is a term that other doctors would say, well, what is that, basically. And but the advantage is that you know specifically what your problem is, and they can address it each one. And unfortunately, when you've got these different levels of your spine, then it's obvious that through pain mapping that you can isolate that problem and deal with it, and that's the most effective way. For me, I would highly suggest that no one ever do a spinal fusion, because that just creates a problem. Because that was one of my questions. When I would go to these doctors and they say, well, your problem is here, and I said, well, I know I have a problem, but what do I do about it? And it was always spinal fusion. And that just seemed reasonable to me, that that's not the way to solve a problem. And they would say, your success rate is 70%, some would say 80, but knowing what I know through this pain mapping, that it's 0% success, because it just wouldn't work. Everything is done as an outpatient, and that's impressive that you can do this sort of thing and leave the hospital just a few moments after, as soon as you wake up. And there are so many advantages over the endoscopic type of surgery. Well, you're awake part of the time, no nausea, no pain, yes, you can stand up and walk. We just get in the car and go back to the hotel because we're from out of town. And another advantage, that you're not weeks in a hospital, because with other types of surgery, the fusion, for example, I say, how long will I be in the hospital? And they say 2 to 3 weeks. And that tells you there's something serious there. Well, actually, you can do it in 2 days if you have good plans. But I would suggest a couple of days to just relax and do it that way. I would highly recommend endoscopic surgery. This is a nice conclusion to a successful operation, because previously my problem is standing and walking, and just standing immediately brings tension in the back. And this is 2 days after surgery, and I can stand without any pain or tension in the back. I'm able to walk, which is my goal.